Uh, as you see, I'm Sumanta Basu. I'm from Calcutta. I'm there in Calcutta for around 13 years. I'm primarily from the operations management group, and that's why my discipline is not exactly in AI, but I work in the modeling aspect. My presentation says it's modeling, but I changed it because the current work involves both analytical as well as empirical a bit, along with my doctoral students. So in this presentation, I will briefly mention some of the issues that I faced, because of my discipline and my training. I primarily focus on the operations part of healthcare management. Of course, healthcare has a big clinical side as well as non-clinical side. So I focus more on the non-clinical aspects. So hopefully we'll find some interesting open problems to see it. The healthcare, it's an iron triangle of healthcare. It's about quality, access, and cost. These are the three things. These are the three parameters which we always look for. And when I'm saying iron triangle, sometimes one aspect is compromised in pursuit of getting excellence to the other one. For example, if you wish to really deliver a very high quality or very high accessibility of healthcare, your cost will be compromised. And that is not only in healthcare, it goes beyond healthcare. For example, in general supply chain also, a big basket, you purchase from Big Basket, I guess. Big Basket, if you purchase, one-day delivery time is there. Now, you purchase it from one-day delivery time, you will find a slightly lesser price. Vis-a-vis BB now, you purchase it right now, they will not offer that much discount. Why? Because they are giving you accessibility. They are promising you speed. Within 15 minutes time, that whatever oil that you are ordering, that will be delivered before you start cooking. Operations management can come up to identify specific things. I will take you certain examples which are not so good for healthcare. And there are many good things about healthcare also, but I will take one or two examples. The first one, I should wear my specs. I don't have a progressive lens, so sometimes I open and close. What happens is, if you see the profitability perspective of a dialysis centers, there is a study that happened and showed that the dialysis centers with a profitability objective, they are less likely to recommend transplantation of the patients, and hence they have a higher mortality rate. Why? Because they wish to continue with the patients. The patients are giving them money. Why do you wish to withdraw them by giving transplantation? It may be good for the patient subject to matching, but they don't want to do that. That's a perverse incentive problem. Okay. In the similar line, if you see the uptake of multiple listing means I need a liver transplant. I'm not, fortunately, I'm just taking an example. I'm associated to one hospital. But the multiple listing says that I'm listing with multiple hospitals, and then whenever the organ is ready, that organ will be transplanted. But the percentage of this multiple listing is pretty low. The question is why? The key reason that they are saying is again the adverse selection. The transplantation center is concerned with the patients more inclined to advantage. So what they are saying is, if they offer this multiple listing, what will happen is the more richer patients will opt for this. Hence the revenue stream will be dried up, because these are the guys who will continuously give them money. So they didn't want that. Third example, in US, what happened was they came up with good drugs. For that they don't need any transplantation and so on. But the drug is so expensive that after 3 doses they stopped giving that. The insurance firm initially were very happy and started paying for those drugs. But after 3 payments, they realized that they cannot afford it. So the question that they try to understand in healthcare, and there is a big operational angle, because the question that we are talking is not related to the clinical side of healthcare. It is mostly to the economic side, to the operational side, to the technology side. Why this? There is a book by an American sickness. It's an interesting book because they heavily criticize healthcare industry and the stakeholders who are involved in the decision making. Why they're saying that, in fact, that is valid for us also. CGHS patients, the question is the central government scheme patients, Are they getting the similar level of, care whenever a person is going to a private clinic? Not sure. Question is, can we improve the system? The private hospitals will object to that because they are not as revenue generating as a private patient who comes to the hospital, right? Because there is a fixed payment which is getting offered in healthcare. So an operations management guy, and I will tell you the operations perspective, the way the management guys think, it is called a fee-for-service system. In fee-for-service, you wish to keep the patient, okay, I'm not criticizing the private healthcare facilities, but just trying to tell you rationally. Now, hence, the whole paradigm of the operational mechanism changes, from keeping a patient for a longer duration, which is a stack model. You are building up stack. Stack is what? Stack is basically piling up on the number of patients. To the flow model, where you don't want to keep the patients for a very longer duration, but you want to increase the flow, which is, you wish to increase the speed. Specifically focus on the very high profitability that the healthcare providers enjoy. Now, coming back to what are the intersections of technology and operations in healthcare management? And we see that there are abundant opportunity which we are seeing. Currently, I will define what the healthcare, how an operations management guy sees healthcare. But broadly, if you see this graph over here, this is how this basically indicates the percentage of executives, indicating a big impact which is happening because of technology. And healthcare is not in the forefront. We are talking about the complete supply chain which begins with a drug manufacturer and then ends up till the consumer or the patient consumes the drug or avails that particular service. And in between, there are many touch points, many interventions that may happen in the form of wholesaler, in the form of distributor, the hospital itself. There are the insurers, right? There is the diagnostic clinics, pharmacies, and so on. In fact, there are post-operative clinics also. So in the whole, cycle of the supply chain, there are different players where things can change. I will just quickly tell you how healthcare is getting affected by the technology and how the decision-making paradigm is changing. So some numbers again. If you see this graph, this kind of indicates how telehealth and mHealth, the mobile health, is taking over the traditional face-to-face interaction which is happening. Now, very quickly, just to differentiate between what we mean by telehealth and mHealth, the unit of analysis is different. In telehealth, these are the healthcare providers or the hospitals who use that technology. Whereas in mobile health, it is not the hospitals, these are the patients, these are the individuals who basically avail the technology to avail the health services in a way. And in the digital health facilities, that covers a gamut of devices which are churning data. Some of them we are not exercising, but possibly in future we'll do that. The wearable devices, the watch that I'm wearing possibly will decide the insurance premium that I'm going to pay in some time. If I'm walking more, if the blood pressure, in fact, it monitors my blood pressure, my heart rate, my BPM currently I say it's 94 because my natural BPM is high. So maybe I will be charged a bit higher because I have a higher chance of getting heart attack, hopefully not. But this is how the insurance plan will work in future based on the data. Okay. And there are different analytic techniques that they are going to develop in healthcare. And by analytic techniques, we begin with descriptive and then move to the predictive. When a patient is coming with certain disease characteristics, let's say what is the chance of readmission? It's basically a predictive modeling that we are referring.